Well,
Hello,
hello.
hello.
How are you?
Good. How are you?
I'm doing well, thanks. Welcome.
Good morning. Good morning. Thank you. Are you ready for your 73 questions?
I am ready. I've already made my coffee and I'm ready to go with this.
Perfect. All right. So let's get started. What is your name?
My name is Jonathan Lindman.
And what is your specialty?
I am an otolaryngologist, also known as an ENT.
And how many years have you been practicing?
I have been in practice for almost 21 years this summer.
Very experienced. So where did you go to undergrad?
I did my first 2 years at Gainesville College in Gainesville, Georgia, and then I transferred to the University of Georgia, graduated from there. Go Dogs.
Go Dogs indeed. And medical school.
I went to the Medical College of Georgia.
Good school. I've heard of it. Did you take any gap years before going to med school?
I didn't. I just went straight through and finished up as quickly as I could.
What was your favorite part of medical school?
Actually, I really enjoyed just learning anatomy and friends. Those were the biggest things.
What specialty did you think you were going to go into on your first day of med school?
I absolutely had no idea at all. It was a complete question mark. So,
Well, were there any specialties you said immediately out the gate, just not for me, crossing off the list?
I would say psychiatry. I wanted to do something with the body rather than the mind.
Okay. Well, what first made you fall in love with ENT?
I think the first time I thought I might want to do ENT was really my first year in anatomy when I started doing the head and neck anatomy. That was just very fascinating to me. And so that was in the list of things. I knew surgery was one of the things I was interested in after that first year of medical school.
And how long does your training take after med school?
It takes 5 years currently. It's 1 year of general surgery in most places, and then 4 years of otolaryngology.
Are you in academics or private practice?
I'm in private practice.
And what do you like about private practice over academics?
I love the freedom to run my business the way that I'd like to, and I'm not a huge fan of doing research myself. I'm glad others do that, but that's not my gifting, so I was not interested in doing that.
Understandable. So are there any cons about private practice over working in a hospital?
Are there cons of being in private practice rather than a hospital? I would say running a business is a lot of fun, but it's a burden sometimes as well. And when you work for a hospital, that's taken care of by somebody else. So that could be a disadvantage.
Did you ever consider getting any extra degrees like an MBA or an MPH?
Well, actually, I didn't. Come on in this way. I'll tell you a little bit more about that.
Sure.
Would you like anything to drink at all, or?
Just water would be great.
Okay. So when I joined a private practice shortly after residency, the group that I joined, everybody in that practice was subspecialized, which we can go into more if that's one of the questions. But in otolaryngology, everybody in that group was subspecializing in something, and they wanted somebody to do sleep medicine. And so I was the only one that wasn't subspecialized, so they were like, okay, you're going to do that. And so I was forced into doing sleep medicine. And I actually really ended up loving it. It was a great experience. I learned that I enjoyed learning things that I had no idea about. Of course, part of sleep medicine is snoring and sleep apnea. But I started learning about dreams and sleepwalking and insomnia and periodic leg movements. So after I finished sleep medicine, I said I love learning so much that I decided to get an MBA. And I just finished my MBA 2 or 3 years ago.
Nice.
Here's your water.
Thank you. So what would you say is the most unique part of your specialty?
We are one of the few specialties where you practice both medicine and surgery across the entire breadth of ages. So I treat newborns all the way up through people in their hundreds, and I do medicine and surgery. So if I can't get them better with medicines, I can take that next step myself. There's a lot of continuity all throughout the spectrum of the disease and for that patient. So
Why should someone choose your specialty?
I always tell my students that rotate with me, I feel like I have the best specialty ever. I love what I do. It is by far the best choice. And I think a lot of that stems from the variety that we have in our specialty. As I said, the age groups that you see, you end up being the specialist for their entire family. You be the surgeon for the entire family and build those relationships. So those are some of the things I love.
In contrast to that, why should someone not choose your specialty?
Don't choose my specialty if you don't like snot.
Understood.
I mean, the sound of it, the look of it. I mean, I've had some students just get completely grossed out. There's a whole like factor. If you hear that from a student when you're sucking sucking the stuff out of a nose, you kind of go like, that may be a good match for you. But if you hear like, oh, that's disgusting, the nose wrinkles up, the eyebrows cringe, then that is a sign that this isn't good for you.
Understandable. Fun question. Are there any stereotypes about your specialty?
I may be blind to the stereotype in my specialty. There are stereotypes for every specialty, and I can name them quickly. I think for my specialty, it may be I find most everybody that is in my specialty loves what they do. So I've not found very many people in my specialty that hate what they do. Very few that are burnt out. And I know a lot of people in my specialty. So it may be a stereotype, love what they do.
Next question would be, are the stereotypes true? But I guess you confirmed that.
Yeah, I think it is.
Alrighty. So from a student perspective, even though you work in private practice, are you still able to interact with med students like me?
Yes, I love to open up my clinic to students. I have students frequently just by meeting them in various areas. I'm involved with Bible studies, so we have students over and I get to meet them that way, but I'm just out and about, and also have some relationships with students at local colleges, and so yeah, I just let them come and see what I do and see if they're interested. So.
All right. So since you do get to interact with students, well, what's the craziest question you've asked a student? Someone used the word pimp, but that's an extreme term.
Yeah. There is a when I clean an ear out on a patient and they begin to cough, I will look at the student and I will ask them what made the patient cough. And I've heard just a wide variety of answers. The answer is, if you get asked this question, it's Arnold's nerve. And Arnold's nerve is part of one of the cranial, it's a branch of one of the cranial nerves that has a cough reflex. But I've heard lots of crazy answers like, I don't know, they felt like they needed to cough, or they had something go down their throat, or so I get just most students don't get that answer right, but I like to hear the answers because they're kind of entertaining. Come on this way.
So, in your experience then, as a student or a resident, what's the craziest question that you've ever been pimped on?
Oh my goodness. It's been 15, 16 years ago. I think I've blocked all that stuff out of my mind. I'd have to think on that one. So nothing just pops up into my mind.
Okay.
That.
So are you ever nervous at all coming into clinic or work?
Less and less the longer I do this. I think medicine in general it keeps me humble, because I realize I just don't know everything and I never will. And so in that sense, I do come into work with a little bit of fear and trembling, like what does today hold? But it's a good kind of fear. It's a fear that pushes you to keep you on your toes and to learn and to say, not be afraid to say I don't know. So.
Great answer. Now, some kind of quick fire lifestyle questions. How many patients do you see on an average day?
I see between 30 to 40 patients a day in the clinic.
And how many procedures do you do?
I would say in a typical month, I probably do about 40 surgeries. And then we also have, aside from that, procedures that we do in the office. So between 10 to 20 per week of procedures. And that could be scopes, endoscopes in the nose and in the throat, biopsies. And we also start to do some sinus procedures in the office as well.
And how many hours do you work in an average week?
That's one of the things I love about my specialty. I probably put in 35 hours a week.
Okay. And what time do you normally wake up?
I'm up most mornings around 5 o'clock.
What time do you normally leave the clinic?
I usually leave work somewhere between 4:30 and 5:30.
How many hours of sleep are you typically working on?
I am a lover of sleep. That's maybe part of the reason why I became a sleep doctor. I mean, you spend a third of your life asleep, and so I'd push really hard to get 7 hours, and that's what I feel best on.
How many hours of sleep are you working on right now?
7 hours. I mean, I'm pretty consistent now.
Nice.
At this stage of life, not always has it been that way, but I will not function well if it's less than 6.
Yeah, I love asking all the doctors these sleep questions because you get to see the variety in it. It's important.
Oh yeah,
So,
that's actually a really good question.
how long does it take you to finish your patient notes at the end of the day?
Yeah, so the patient notes question is good. It depends on how you're structured, and we have assistants. We have a nurse who does a good portion of the note for you, but the bottom part, the plan, I will spend time on each patient chart, and I would say for a morning clinic, I'm done within 30 to 45 minutes of charting, and then and the same thing for the afternoon. So a good hour of charting, but I'm always done with it before I leave. Never take any charts home. That was number one rule that I made early on. So.
Good. So, who are you most thankful for in your care team?
My nurse Jackie, by far, she is my twin sister. We're almost the same age. We've both been married about the same number of years, and she is essentially has the same personality as my wife. And so she's my work wife. We laugh about it, and she is sunshine and rainbows.
That's awesome. So, all right, funniest thing you've seen in a patient chart without violating HIPAA or anything?
Oh, I would say there's a worm in my nose.
Ew.
And do you want to hear the story about this? I mean,
Sure, why
it's
not?
short. It's short. So this is somebody that I had operated on 2 to 3 weeks before. I'm in surgery, and they call from the front desk frantic that this lady has worms in her nose, and I wasn't able to come up at the time. And so I said, well, just whatever she can give, leave it there. And she, sure enough, had found a worm in her nose, and it was a particular type of worm that you find in a tree that she had cut down the day before, and it had crawled in her nose, and then it had crawled out, and she was just really concerned about that. But it took care of itself, and it freaked out everybody at the front desk, and then it freaked me out as well. So,
Alrighty. What's your favorite nerdy random medical fact?
Favorite nerdy random medical fact. Oh, boys. I might have to come back to that one.
Alrighty. So I guess again,
When I have something like that, like I typically am like a deep thinker about stuff. I'm very much introverted. So with a question like that, like my mind just wants to go like think deeply about it before I answer. So
good. So again, it's been in the news all around COVID. How has your specialty been impacted by COVID this year?
Our specialty has been impacted tremendously because we are in people's faces all the time, and you hear about the aerosol generating procedures. So things like tracheostomies, things like nasal endoscopies, laryngoscopies, everything that we do, even moderately invasive in a patient, is gonna potentially expose us and our staff to COVID. So we've had to change a lot of our protocols. We've had to test all of our patients before we do surgery. We've had to wear, of course, the N95 masks and the face shields and things like that. But it's kind of a step up from what some of the maybe other specialties have had to do because, again, the area that we work.
Okay. So we've talked a lot about your life inside the clinic. How about your life when you clock out? So what is your favorite thing to do when you're not working?
Well, for that, I will have to show you my study. That is by far my favorite place in our house.
Alrighty. A little grand tour. Why not?
Yeah. So we built this house about 6 years ago or so, and I was like, I have to have a place to retreat, and so this is my study. So this is actually one of my favorite places to come and hang out when I'm not at work. And yeah, so we're not doing family things, but this is by far one of my favorite places. And in the wintertime, the fireplace is always on, and so I actually really enjoy reading. So I've got a wide variety of books around here. My favorite hobby with reading, I think, in the last 5 to 6 years has been reading biographies. So up in that corner of the latest biographies I've read. But Ron Chernow is probably one of my favorite authors. I've read all of his books, and so yeah, reading. Reading's been a big part of my hobby time.
Alrighty. So do you have a significant other or any kids?
Yeah, so I've been married almost 21 years, and I've got 2 boys. They're both teenagers now. I've got one in college, and I've got one in high school.
Does your family ever ask you for random medical advice?
Yeah, so not often, but I think the most recent one that comes to my mind is my oldest son was with some friends, and I get a text message of one of his friends' mouths, or the throats, and was asking, like, my friend wants to know if her tonsils look normal. And I was like, okay. So we had like a little medical consult for one of his friends.
Oh, I guess going off that question, what is the weirdest question a family or friend has ever asked you?
Yeah, I would say that's probably been one of the strangest questions I've been asked. And it led into some other questions about what could cause it and other things that were just a little bit funny to do. But now that with COVID, I mean, we are doing more stuff through video and through pictures and things like that. So
Yeah. So any pets?
we did have a pet, but the pet has passed away, so we've not replaced. Yeah, Butterbean was our cat, and Butterbean is no longer with us. So it's okay.
Aw. So dog or cat person?
I would say I'm more cat.
Favorite animal, not a dog or cat?
I would say probably more bird. I like parakeets. I grew up with some parakeets, though.
Yeah. If you could have dinner with anyone in history, who would it be?
I would love to eat with the Marquis de Lafayette. In fact, I have a little area up here in my study that's dedicated to Lafayette, and the sacrifices he made for our country, I think, are pretty amazing. So
at that dinner, what would you guys be eating?
whatever he wanted to, probably something French, but there would be some American food. I'm sure he would insist on that. So
What's your favorite dish to eat?
I like pretty much any fish dish, like salmon, fish, shrimp. I'm a big fan of the Old Country Boil.
Any favorite restaurants around here?
Yes, Frog Hollow takes number one for sure. We go there at least a couple times a month.
Coffee, tea, or soda?
Coffee.
How much water should you be drinking every day?
8 to 10 glasses. I easily do that with as much as I talk behind a mask. Now I'm drinking so much more water.
So what was your favorite meal as a kid?
Grilled cheese. Grilled cheese,
Classic.
tomato soup, yeah.
What's your favorite healthy snack?
I like apples and a handful of almonds. Are really good too.
Favorite guilty snack or cheat meal?
Cheesecake.
Solid choice. And all right, controversial question. Pineapple on pizza, yes or no?
Oh, absolutely. As long as it's with a good chunky ham, it's all delicious.
Polarizing.
Let's
Oh,
go over this way.
sure.
I'll show you a couple other places.
So Apple or Android?
Apple.
Any artistic hobbies you keep up with?
Yeah, so I've actually developed, along with reading biographies, I've enjoyed doing some drawing. And probably within the last few years, I've learned to draw things like, I've actually drawn an ear, I've drawn a heart, but I've also drawn some flowers and things like that, sketches, things like that. So it's all been self-taught, so it's not very good, but it's a lot of fun. And I find like just with my surgical skills, I enjoy just the details of drawing, and it brings a lot of people joy. I typically put it in a card, and we'll send it to people, handwritten cards, along with the drawings. Seems to be it brings a lot of joy to people when they get those. So it's been a fun hobby.
So what kind of music do you listen to at the clinic?
I listen to the Apple Chill station. It is great. It keeps me in a very chilled mood, very happy, upbeat, and the staff like it too.
Okay. So what's the best way that you relax after a long day?
Well, I would say sitting in front of my fireplace in the winter is one of my go-to places. I also there's a couple chairs in the living room that I'll go to. I'm really vying for a massage chair, but my wife won't let me get one because it doesn't match anything else in the house. So I just keep asking, and eventually I'll get one of those. But that will be my ultimate go-to place, is a massage chair.
So night in or go out on the town kind of person?
It varies. I would say I tend to be more night in, but sometimes I'll get the mood to go out on the town too.
So indoors or outdoors?
Outdoors.
Beach or mountains?
Beach.
Would you consider yourself more of an introvert or an extrovert?
Introvert.
And do you think that personality trait was a factor in you choosing your specialty?
I think so, because I like to be an expert with a very small field, rather than having to know a little bit about a lot. And so maybe a little bit of a factor.
Okay, so thank you so much for your time. As we wrap up, I want to ask a few more reflective questions. So, what did you think you were going to be when you grew up as a kid?
I knew that I was being called to healthcare probably when I was in 6th grade, and I just stayed on that trajectory my entire life. But I was going between dentistry and medicine up until probably high school, sometime in high school, and then committed to medicine. And so I knew I wanted to be a physician very early on in life. Nobody in my family was a doctor, so I didn't have any role models, I guess, within my family, but more of just a calling.
Is there a different specialty you think you could have done?
That is a great question. I think I would have been also happy with ophthalmology. Ophthalmology was one of the other things I was considering, but it would be a very far second. I am so thankful I chose this specialty.
And if you didn't do medicine, what did you think you'd be doing right now?
If I was not in medicine and money was not an object, I would totally be a musician. I play trumpet, I play drums, I play a little bit of piano, and so when I watch, like for example, if anybody watched The Voice before, there's always this band that plays, and they're an amazing band, and the drummer for that band is having so much fun, and I'm like, I would be up there playing the drums if I wasn't a doctor, and you could make a living. I'd have to be really good at it, but I'm definitely music, for sure.
Okay. Now, were there any times you doubted you would make it as a doctor?
I would say there's always moments of doubt. The doubt will come and go with tests and quizzes and hard sections of physiology. I remember heart and the pulmonary sections were just super challenging, and you do question like why am I going through all this, and this just isn't clicking. Genetics, I struggled with genetics, still to this day struggle with genetics. Immunology, there's certain things that just, when I went through it the first time, stirred up doubt about, is this the right thing to be doing? But they're short-lived moments, and never felt significantly, I never significantly questioned me being a doctor. I knew that was what I needed to do, but of course, yeah, the moments of doubt will come with tremendous waves at times during medical school, and to a lesser degree, I think, in residency.
So, if you could change one thing about the medical field right now, what would it be?
I would love to change the rushing that you feel, the pressure to rush through your patients. And it's just the economics of medicine have changed. It's becoming more business oriented, which is part of the reason why I wanted to get my MBA, is that I could potentially make a personal impact on the way we develop systems in our clinic that would accomplish successful business goals, but yet still be able to serve the patients in a way that would provide them with excellent and compassionate care. So there's nothing greater than having a clinic with just a few patients to make you slow down and just remember, hey, this is all about being able to spend time with patients and really dig into their problems and help them with it. It's harder to do that when you're rushing through it. And so I'd love to have those types of days every day, but it's not practical.
Mm-hmm. So what can a medical student do right now to prepare to go into your specialty?
What was the question again?
What can a medical student do right now to prepare to go into your specialty?
What do they do? Yeah, I think I'm not exactly sure how competitive our specialty is. When I was going through, it was very competitive, and I suspect it still is one of the more competitive ones. You may know more than me, but I think that surrounding yourself with other physicians that are doing that specialty, going to shadow. I think shadowing is probably one of the best things you can do to prepare. And then just reading, some of the student-geared books like medical, some of the Pearls books. There's other online resources, websites. Frankly, I didn't really know everything that an ENT did when I got into my specialty. So one thing I would tell students is don't stress out. If you feel even an inkling of interest in ENT, because it's hard to have exposure to a subspecialty, I think, in your medical school training. Get around other ENTs, and then I love what I do, but I had very little idea about what we do until I got into residency. And so you don't necessarily have to know everything about the specialty before you choose to do it. It's just a step of faith, and you just do the best you can with what you can learn about it, with the resources you have. And you have a lot more resources now than ever before online and people too. So.
So if you were to go back, would you change any of your experiences that got you to where you are right now?
Nothing really stands out that I would change on my path. I mean, I think that I'm very pleased that I went straight through. That was a good fit for me. Well, perhaps one thing I may change is after my residency, I may have done a subspecialty. I actually really enjoyed plastic surgery, and we do have a subspecialty within facial plastics. So I may have done that, but it just wasn't a good fit. And even if I had it to do over again, it may not have been a good fit because I was married and had 2 kids. It was time to get out. It was time to make some money, and so it just wasn't a good time. But yeah.
All right, and finally, question number 73. What would you say to the aspiring ENT physician right now?
I would say The future is bright for our specialty, and I say that because there is such a breadth of things to do within our specialty: medicine, surgery. The economics of it are fantastic because you are taking care of everybody, and so you get a nice kind of a mutual funds of medicine, so to speak, for your payer mix. And then you have just so many things being discovered within our specialty and research to be done, and generally very happy people to be working around. Our like I said, my colleagues are happy with what they're doing, and they're happy to be around, and a lot of positive energy in our specialty. So yeah, it's a great field to look into. Highly recommend it, and appreciate the opportunity to be able to talk about me and talk about our specialty.
Of course. Well, Dr. Lindman, that is all I have for you. So thank you so much for sharing your time, your stories, and your expertise with us.
Yeah, you're welcome. Thank you.
All right.